I was standing one day and my father's friend saw me and noticed that my right leg was knock-kneed. So we had x-rays taken, and then we realized that the bone wasn't aligned straight on my knee.
She was having recurring knee problems. Seemed like every few weeks she'd tweak her knee and land awkwardly.
Maggie presented with what's called, in general terms, a knock-knee deformity. The long-term risk was arthritis. The short-term problem was she was having recurrent knee sprains and knee injuries.
We'd originally scheduled the surgery for January of 2010. That had been scheduled by Dr. Widmann's office, and I was like, I want to schedule it myself, and I want to be ready so I can mentally prepare.
Maggie underwent a gradual correction of her deformity using what's called an external fixator, which is a frame that goes on the outside of the body and is held in place by a combination of pins and wires.
Every day they gave me a schedule, and it had a colored pin on it, and it would say turn from like 122 to 123, and so I would turn the screw. So after a month, the turning was over, but I still had to have it on to let it settle and heal. I'm really active in school. I do a lot of sports and I'm in a lot of clubs, so it felt really weird for me to just go home and not do anything and just sit there. And so physical therapy was where I would go. Because of physical therapy, I was able to walk with one crutch and then later no crutches with the external fixator on. So I think recovery really depends on how hard you work in physical therapy. Since October that I was cleared for full contact, I haven't had one of the injuries that I used to get. It was almost a given that I would get an injury, at least during every season. One of the injuries where I would tweak my leg and twist it in some weird way, but I never had an injury. It feels fine. It feels exactly like my left leg now.
At her last follow-up, she's got full range of motion. She has full strength in her leg, and from a athletic standpoint, she's back to where she was before the surgery.
So when I was going into surgery, I didn't speak to anyone. I didn't have a video to watch. You can make it through. And so I wanted to do this video to help other patients that are going to the hospital.